It's been a while since we've met on this platform. And that is a good sign, because at first we were doing it every day, and it's because we were in a cluster, in a crisis. We have, with the help of the Chief Medical Officer, Permanent Secretary in Health, and the health team, who have worked diligently, we have been able to see light at the end of the tunnel in that regard. And we want to thank them for the hard work and for the commitment to keeping Anguilla safe. We do know that we dodged that scare, but it was only because of being able to detect early and to put in place the protocols that were necessary, the regulations that helped us to govern those protocols, and that is what it takes to be able to maneuver through this COVID pandemic, this crisis of health, and that we came into and have continued to lead in. I want to thank the people of Anguilla for following the protocols, the hygiene methods, the social distancing, the mask wearing, for being there when you're asked to stay home, staying home. And we also want to be cognizant and vigilant about our borders, that the only way we can ensure that we control what happens in Anguilla is if we have people compliant and follow the regulations as they are. Breaching those borders is not helpful. It causes distress. It causes the health team to have to work harder when we're already stretched thin. You, the people of Anguilla, know what our healthcare capabilities are, and in this COVID time, we know that those healthcare services can be overrun very quickly if we don't continue to be diligent and continue to be vigilant and continue to follow the protocols as put in place. So we still have restrictions in place. That is, those are there so that we can continue to mitigate against the COVID-19. It is still a disease that can kill us, and we want to keep it off our shores if we can. But if it does come, we want to make sure that it's in a controlled fashion, so persons can be isolated and can get better, recover. We want to make sure that there is no spread in the community, and that's what we work for. We see in our neighboring territories that this has become an issue now, and we want to continue to be there to make sure that we get past these. I know that it's been a while, and we're getting COVID fatigue, but it's when we let our guard down is when this thing can come in and can cause severe harm to our healthcare systems, to our people, and we do not want to see that happen. Also, we want to know that as we get to the end of the month and we're thinking of loosening up the restrictions, and that we continue to be vigilant and continue to follow the protocols. The portal, we know the new portal is open, and there have been a couple of glitches, which happens when anything is new, but those are being worked out. Returning residents have been able to come since the 21st, which is last Friday. And today we have visitors being able to come to Anguilla, and certainly we welcome visitors, especially the fully vaccinated, and that's we want to let people know that there's still the bubble is still in effect, and we hope that we can get vaccinations here to so that we can continue to vaccinate our people and get to herd immunity. So again, thank you very much. Thank you for Minister for moderating this session today, and we look forward to a very informative session.
Very much, Premier, and thank you for giving us that update. We would like to go quickly into an update by the Chief Medical Officer, the Permanent Secretary of Health, Chief Medical Officer Dr. Angerin, and Permanent Secretary of Health, Mr. Foster Rogers. Any one of you can go first. I see you here with us.
Well, I guess ladies first as usual. No, I'm going to keep my remarks short and sweet. As the Premier said, well, today we can say that we have no active cases of COVID-19 on the island, so that's great. All our cases from the cluster have resolved. As you know, we had no further hospitalizations and certainly no deaths, so that is very, very good news. So you recall that our last confirmed cases were on May 10th. That was a couple of weeks ago. We didn't have any transmission from those cases, of the transmission there. So that's good news. And in terms of what we call the incubation periods, we're already half of the way there. We said we need two to really confirm that there's nothing else going on. We're already midway. We've completed a one whole incubation cycle, which is at 2 weeks. So in 2 weeks, which is June 7th, we're going to be able to say to the international community, look, we've passed through our cycle. We have no cases. The cluster is resolved. So if things keep going in this direction, knock on wood, then we'll have more celebrating to do in 2 weeks. So we're poised to, technically right now, we are pretty much back to where we were pre-cluster, and we'll be able to say that with conviction to the entire world in 2 weeks. So let's hope that there are no surprises, but things are looking pretty good for where we stand. So that's very, very good news. I'm very excited to report that. And thanks again, as the Premier mentioned, for the cooperation and the patience of the people, because this has not been easy, certainly not. So we're looking at June 7th for that date to say we're officially revert to stage 0 as per our escalation plans. Just to note that our vaccinations came on strong. We are looking, however, to plateau at around 10,000 registered persons in the portal. Right now we're at 9,441. Of those, 8,969 have received their first dose, at least a first dose. So that's over 70% of our target population. And of those, you have 5,272, which is upwards of 42% of the target having had dose as well. We've seen increases along all the occupation categories and the age categories. However, we really want to get above 10,000. 12,000 would be ideal. Remember that this 70% of one is a bare minimum. And we're talking in terms of 70% of the target, but we really want 100% of the target, if you know what I mean, to achieve more than 70% of our population. So I'm not wanting to something that's good news in short. So we just have to keep on as we have been. As the Premier said, we started receiving visitors on our shores a few days ago, and that has gone smoothly. No surprises there. No negative consequences thus far. So we're in a very good place right now.
P.S. Rogers.
Thank you very much, Minister. Good afternoon to everybody.
All of the salient points, but I'm sure you would like to add something to some of the points that you may have missed.
No, just a couple short points. We certainly do thank the people of Angola for responding to us during this difficult period. As we know, closing down is not the easiest thing to do. We did relax some of the hours last week, Friday. We pushed back to 8 p.m. to 5, from 8 p.m. to 5 a.m. And certainly things keep going this way. By this weekend, again, we'll probably move things back further. So we are definitely moving in the right direction. We want to thank all Angolans, all residents for their patience and for the understanding. With regard to the vaccinations, we certainly do encourage people to come out and continue. Those of you who have not yet had your first dose, please come out. We do have our staff at the park. We're now doing first and second doses at Webster's Park drive-through, so it's much more convenient now for everybody. And certainly as well, we want to encourage those who've had the first shot to make sure come back and do the second shot, because you're not covered until you have the second shot, and then until another 2 to 3 weeks have passed since having the second shot. So having the first shot is not the end of it. Having the first shot is the first step, but certainly we encourage people to come back and get the second shot as well, so you can be fully covered. Thank you very much, Minister.
Dr. Rogers, It's always a pleasure to have you with us, and your voice is a voice of comfort in these difficult times. Is the Commissioner of Police on today? Is he around? I'm not seeing him. If he is there, I would really like to hear from him. Commissioner?
Hello there, good afternoon. Thank you for having me back. I'll be very brief as I normally am, really. It's been a good weekend overall. I'll just cover the last 3 days in the update, really. Over the last 3 days, there's been 23 land patrols, 4 vehicle checkpoints, 20 vehicles stopped, 13 breaches over 3 days, which is quite a low number, 13 people to be prosecuted. There's been 9 scene patrols and 1 boat intercepted. So it's obviously out in the ocean, it's fairly quiet at the moment. But that's overall, it's been a very good weekend, really. Compliance has been pretty good. 1 or 2 slightly foolish acts with people having a house party and a couple of people driving home late, which are the essence of some of the prosecutions. But overall, compliance has been really good. And if you look at those figures, each day there's about 14,000 plus people on this island. And we had 7 breaches Sunday to Monday, 4 Saturday to Sunday, and 2 the day before, I think it was. So the numbers are low and most people are doing really, really well. And as the doctor was saying, it's a difficult time to be locked down, but people are really toughing it out, being excellent and trying to do their part for Anguilla, so I'm very grateful. But that overall is the update from the Royal Anguilla Police Force.
Thank you very much, Commissioner. We are now open for questions from the media. You can show your hands and we'll be open for your questions. We're also fielding questions from many of the persons that are listening via the social media in the World Wide Web. I see a hand up. I'm not sure whose hand. Oh, Felicia from Radio Anguilla. Go ahead, Felicia.
Okay, thank you. Good afternoon. The Commissioner of Police just mentioned a number of breaches and X amount of persons supposed to be prosecuted. I'm looking at Executive Council minutes, which was uploaded just on Friday, and at that time it said since April the 24th there had been 100 land patrols and 77 breaches have been recorded and 77 persons will be prosecuted. Can we get a total number to this date of how many persons will be charged?
You can after tomorrow, because I've actually got the meeting tomorrow, I think it's 12 o'clock, where we're just making sure that all the cases match all the numbers that I've been stating. But tomorrow, I think it's 12 o'clock, we've got the meeting with the prosecutions inspector, and certainly the next media conference I'll be able to tell you exactly how many people are going to be put before the court.
Okay, and also in the minutes, it also spoke about the assistance from the St. Martin authorities or the French or Dutch. Could you tell us how involved they were in helping to secure our borders?
Not so much, really. The part of the, I'm not quite sure how involved they've really been. We've done our part. They've certainly helped us out with positioning some mobile radar they've got, and we requested that, and they did that for us. But overall, most of it is intelligence sharing, because obviously they have got so many assets and we've got so many assets. So we've tried to combine the assets. But overall, theirs has been predominantly intelligence gathering, including the use of mobile radar, for which we're very grateful. And that obviously helps us. But essentially, obviously, it's our borders and we need to work with partners to make sure the borders are safe. But essentially, we've relied on our own assets, other than those intelligence assets which we've been using.
Okay, thank you. I have a question for Mr. Rogers. Mr. Rogers, we know a number of Caribbean islands are sharing the vaccines that they have not used. I understood that we received 500 doses from Montserrat today. Is that true?
Yeah, we did receive 500 doses of AstraZeneca from Montserrat on Sunday, actually.
Okay.
And they are being used now. Of course, we would want to use those that would expire. So we want to use those doses that came in would have expired at the end of May. So we're happy to take some of those so that we can use them here as part of our program before they would expire.
Okay, we know everything has an expiration date, but in this particular case, how does the government or the Ministry of Health intends to dispose of the vaccines that may be expired later on?
Well, it's the process for disposing of expired vaccines. It's not simply dumping them in the garbage. There's a way for disposing of them. And certainly the vaccination team here in Angola knows how to do that. We do it often. It's actually a way of disposing medication.
Okay, cool. Thank you. Because I know in Malawi, I saw that they incinerated about 19,000. So I was just curious how we go about it here.
Thank you very much, Felicia. We'll go to Brenda Carty of the Daily Herald, and then we go over to Class FM.
Good afternoon. People who are fully vaccinated are now allowed to go to restaurants for sit-down service. I understand that the staff of those restaurants are all supposed to be fully vaccinated. So my question is, how is this being monitored?
We did answer that last week as well. Based on the current regulations, all businesses are supposed to have a list, as it is right now, for patrons entering to indicate that they're vaccinated, and a list of names so we can do some contact tracing if necessary. So that's how we monitor the patrons. And certainly with regard to the staff, employers need to ensure that the staff is vaccinated.
Okay, thank you. Another quick question. The new vaccination cards that we're going to get sometime this week or next week, I believe. I don't know whether the arrangements have been made for collecting those, but I wanted to know, people who are leaving the island maybe later this week or early next week, what would be the process for them getting their card ahead of time?
These vaccination cards involve photographs, so I think you have to be present here to grant them. So we'll have to discuss that moving forward.
When are they likely to be issued?
Brenda, we didn't hear your last question.
The IT department,
My last question was, when are they likely to be issued?
We'd have to get some final feedback for you between the DGs. We'll follow up with them, and I'm sure they'll be sending some information out shortly regarding that.
Thank you.
Thank you very much, Brenda. Class FM, I see your hand is up.
Yes, good afternoon. My question is for Premier Dr. Ellis Webster. Doc, you would have informed us, the public several weeks ago that the AG was completing legislation for mandatory vaccination. What is the status on this legislation?
Thank you, Hammer. The AG Chambers is still looking at the regulations on that. We have basically said that persons who have unavoidable contact with the public need to be vaccinated so they can continue in those positions. And that is still being worked on at this time.
Okay, and another question for you here. So I know that how the Labor Department resolving cases of those workers who are currently being terminated from the employment because of being unvaccinated. How are you addressing that?
Well, I have not been in contact with the Labor Department. I don't know if the Labor Minister is on, the Honorable Kenneth Hodge, but certainly that has not come to my attention.
Okay.
Thank you very much, Class FM. Is there another question?
That's it. Thank you.
I would say this to you, Class FM. I personally have not been aware of any terminations from any institution due to a lack of vaccination. So that's news to me. The Minister of Labor is on. I don't know if he has any knowledge of that. Maybe he can answer that question. Honorable Kenneth Hodge, are you there?
I'm referring to persons here, persons who were affected by this, some persons who would have been sent home. that's the gist of the question, actually. If labor, I'm sure labor would have been contacted, I'm sure, by some persons.
I heard your question, but I understood your question to mean that persons have been terminated for not vaccinating. Is that the question? And how labor has handled that?
Yes, sir. That's the gist of the question.
Okay, no, I was saying that I personally, and the Premier have just spoken about that too, we are not aware of any persons that have been terminated for not vaccinating. But the Honorable Minister of Labor is on. I would like him to answer that question. Maybe he is more aware than we are. Minister Hodge?
Thank you, sir.
All right, while Minister Hodge gets to the line, I'll take another question from Dan William. Dan William, your hand is up. We'll go back to your question on Class FM.
Good afternoon, James Harrigan here. A question for the Premier and Minister of Finance. We have been in lockdown for the past weeks now, and we realize that the financial situation is very grim. Can you give us an update on ideas to what the financial situation is like and how, what plans you have to remediate this?
Thank you, James, for that question. Certainly, you would understand the situation is not good. We did not start out very good when we came into office in July of July 2020. And certainly with the pandemic on and tourism being our main industry, with the phased reopening that we've done and with the able assistance of the health team to get persons in as they did, keep the bubble going, we were able to get to limp through, I would say. Certainly, we have continued the unemployment assistance of 1,000 EC dollars a month. I'm asking, the technocrats and the ministry to see how we can extend that, if there's funding available. We certainly know that we have financial problems in Anguilla. That is something that we are working with. And so I would say that the situation is grim. It's not dire, but we have to get back to our main economy so that we can have revenue coming into Anguilla. We have to be able to pay the public service for the service that they're providing. We also want to be able to make sure that there's work for hospitality workers and others, and that's what we're working on right now diligently. The Ministry of Tourism is again, advertising Anguilla as a safe destination, and I think that the work that has been done to protect against COVID during this just over a year, almost a year and a half, is something that is commendable, and we all in Anguilla should give a pat on the back and honk horns for the health team, which has done such a great service.
With Four Seasons Anguilla opening today, I think it's the opening today, how do you see this opening affecting or impacting any plans for your financial recovery?
Well, I think that I don't know that Four Seasons closed in between, but if they did and the opening today, that's great. What that does, it means that as visitors come to Anguilla, the accommodation tax will come in. That will help to put money in the consolidated fund so that we can utilize that for the services that we need to do. We can continue subventions to the health authority, water corporation. We can continue to provide services to the vulnerable, the elderly, and the very young. We can make sure that persons who have to go overseas for medical care, that can be paid for, and also provide, salaries for the, public servants that are doing the work of this country. And also, as I said, it will help to get our hospitality workers out so that they can also make a living And I think that would be good news for us to know that we can continue to boost our hospitality industry and tourism industry in these times.
How aggressive or how versatile is the campaign or, efforts of the tourism department to make an impact on tourism at this time?
Minister, I think that's yours.
Yeah, Minister.
That question to me.
How versatile or aggressive are you acting right now to make an impact on tourism?
Can you repeat again?
No, I was wondering how versatile or how aggressive you are right now campaigning to put Angola, so to speak, back on the map as far as tourism is concerned after this closed down.
Oh, well, we didn't stop our tourism marketing. We always had an exit plan. And just to note, James, Four Seasons did not close. The only hotel that closed during the cluster was the Cuisinart Resort and Spa. As a matter of fact, the prospects of the future look so good that the Zemi Beach hotel has announced its opening and the occupancies are looking quite robust. So we're very happy that so many people have interest in coming to Anguilla. And as you know too, James, starting July 1st, only vaccinated travelers will be allowed to visit Anguilla. While it is locals, Anguillians, residents, can come to the island unvaccinated, only vaccinated travelers will be coming to Anguilla. So it says a lot that we have already served notice to the world that we are welcoming only vaccinated travelers, and the numbers are so robust. So it says that at least for the demographic that we try to attract to Anguilla, those persons are taking COVID very seriously.
Okay, thank you, and thank you for the correction as well, sir.
No problem. I see Don Hodge. Don, your hand is up.
Yes, it is. Good afternoon, all. I have a couple questions, one pertaining to education, the other one infrastructure. But before I ask my questions, I'd just like to circle back to Brenda's comments about the staff in the restaurants and the response. I think that if patrons have to show up with their blue card in order to be served, there should be equity in terms of the servers ensuring the patrons that they are also vaccinated. So if there is no process for that yet in place, I think something along that line should be done. I don't think we should have to ask the servers, are you vaccinated? I think that should be crystal clear. So I just wanted to say that. So my question for education, I believe Campus A reopens in June. I don't know if the Minister of Education is online. Minister.
Don, can I ask you to hold the education questions for either when the Minister of Education is hosting the program or when we resume to normal press conferences?
Okay, but I just want to say that there.
Sorry?
There, because I will, but I just let you know that because Campus A reopens next week, we're getting a lot of questions asking for clarity of process. So if the Minister of Education can be on for the next conference, that would be very helpful. But in line with that, one of the questions for education that I think I can still ask is about the vaccination status of the instructors, the teachers. There is concern that, students are going to be going to school live, not online, but live, and possibly could be taught by teachers who aren't vaccinated. And there is concern about the virus getting passed to these kids who are too young to be vaccinated. And then the kids taking the virus home and, possibly starting another cluster outbreak. So I just want to put that out there as well. I don't know if the health team wants to comment on that at this point.
Mr. Rogers, PS Rogers, would you want to comment on that?
Yeah, I think I've addressed this on more than one occasion, in multiple fora. Certainly, there are teachers who are frontline workers in the hotel industry, and we know that for a fact. There are teachers who worked in more than one sector, and the children cannot be vaccinated at this point in time. Cannot be vaccinated because we don't have approval to do that yet. And certainly, we want persons who are dealing with vulnerable populations to be vaccinated. So yes, those are concerns that everybody has. Those are concerns we're looking into. And certainly, as the Premier mentioned earlier, the chambers are working on ways for us to deal with this.
Okay,
Thank you.
and
Yes.
I have one more question, and it's for Minister Hughes, Infrastructure. Congratulations on the strengthening of the runway at the airport. The road that runs adjacent to the flight line, the bypass, do you have an opening date for that yet? And if you do,
Yes, I
you share
do.
that with us?
I can prematurely announce the opening date of the George Hill Bypass Road, and that will be 10 o'clock tomorrow morning. We have a short opening ceremony that will be, we will have the presence of Her Excellency the Governor, the Honorable Premier, the Honorable Minister of Health, and others, the road engineers, and we will have a short ceremony, and we'll break champagne on that road.
And I'm assuming that the media is invited to not only take pictures, but drink champagne, right? Just
Well,
joking.
the media can drink all the champagne and take all the pictures. You're duly invited.
Okay,
With
and
for social distancing protocols in place, and so long as we don't exceed 25 persons.
oh, okay, okay. And actually, I have a few questions for you, but I'm just going to ask one more. Could you give us an update on the ferry, the plan to start building the ferry, the contractors, the breaking ground? Where are we with that? The ferry terminal.
Well, at present, the tendering is still working through its process, through the procurement process. They're reviewing the tenders, and hopefully we'll be able to announce something in the very near future, one way or the next. It would appear that some of those bids may have failed, but we don't have a full report that we can give to the public until everything is completed. So we'll be able to advise the public, inform the public and yourself very, very soon, perhaps as soon as next week.
Great, thank you all.
You're welcome, Don. Is there Dan William? I see your hand, James.
Yes.
And
James.
Felicia. So James and then Felicia.
I have a rather sensitive question to ask in terms of vaccination. There are some people in church who are vaccinated and some who are not. And we see that there is some kind of a division between the churches, between the vaccinated and the unvaccinated. How do you, as a government, view this?
Foster?
Well, I think at some point in time, once we get back to a status in the country where we're reasonably safe, that the virus is no longer amongst us, then we can make certain concessions. Then we're able to make some decisions with regard to persons coming together, whether they're vaccinated or not vaccinated. But until such time, when we don't know the risks, when we don't know what's happening in the community, I think it is still safe to say that we have to ensure that we keep our persons who are gathered in groups as safe as possible. If we did not do that, then we'll be more or less in dereliction of duty. Because certainly if there is risk that there's virus out there that we're not sure about, then it is very prudent that we ensure that persons who are protected as best they can gather together until such time we know better. But I think in the middle of June or thereabout, we'll have a better idea where we are. And at that time, we make some more decisions, maybe even before then. As the CMO indicated, that'll be, I think the 7th of June is when we'll have our 2 incubation periods from the last positives or thereabout. We'll be able to make some decisions then. But at this point in time, based on the fact that we simply do not know the risks of there, it would be simply a dereliction of the duty of the Ministry of Health if we do not ensure that people who are allowed to gather can gather very safely and not take things back home to children and persons who cannot protect themselves.
Thank you very much, PS. Felicia, Radio Anguilla.
Yes, good afternoon again. Mr. Rogers, some time ago you made mention that when the vaccine becomes available for children, this will be a requirement for those attending public school. You also made mention that you already have it in your exit strategy plan. Could you share with us what else do you have as part of your strategy plan as it relates to the wider public?
Well, that exit strategy has been published now for 2-3 months, so it's no secret. It has been published for some time. It goes on with to October. In fact, we had to do a little detour, and we've had to put 4 steps in the middle because we had this cluster beginning on 21st of April. But we had to put 4 steps in there to get back to our July 1 point where we want to begin to invite people to come in who are vaccinated, and at that point in time, they won't need to be quarantined. So I don't think I need to expand too much on the plan because it has been out there for quite some time. If there's specific questions you have on the plan itself that'd like me to elucidate, I'll be happy to do that. But it is correct. Children certainly will be priority once we are allowed to vaccinate them based on once they're approved. They'll be priority because we know they're very vulnerable. It's very difficult for children to social distance. They play together, they hug together, they run up and down. You know it is, and so it's very important that we get our children protected as soon as we possibly can. With regard to the other steps, August and September of this year will be, if everything goes well, we will be moving into those different portions of the plan where we can begin to welcome people in without having to do even entry tests by the end of September. By September, that is, all you need to show you that you are vaccinated. Once we have our vaccinations numbers here in Anguilla up to our levels, and the CMO spoke to that very lucidly earlier, if we can get up to our levels rather quickly, then having people come in who are vaccinated, we won't need to test them before they come. Once you can prove you're vaccinated, you come to Anguilla. Once our numbers are up, including anybody who can be vaccinated, then you're free to come to Anguilla. That's where we want to be. We cannot, in a normal year, we welcome over 80-something thousand persons to Anguilla through different, from different countries. We do not have the mechanism to be testing 80,000 people to come to Anguilla. We don't have the manpower, we don't have the testing capacity. So we have to get back to a point where vaccination is the way of allowing people to come to Anguilla.
The Anguillian, James?
Yes, is there a difference in time for closure of the local restaurants in comparison to the other hotel chain restaurants? Is there any difference in closing time for the restaurants?
Well, typically,
yeah, there's a little difference in closing time.
Go ahead, PS. Go ahead, PS. Go ahead.
Yeah, there's a little difference in closing time for bubble restaurants that are on property that are certified. They are allowed to go up to, I think it's 10 o'clock, because they are basically quarantine restaurants. Those people are not allowed to leave the site. They are in, and we always try to explain to you that the bubble is basically a broader system of quarantine. Your limited movements, your limited actions, you're tested when you come in, you're tested when you have to leave. So the bubble people in Angola are the most tested people that come in to go to Angola. So yes, there is a little difference there. In Angola, in the general public, currently, other restaurants have to close at 7 because those people are not restricted. They can move about Anguilla, they can go from Wailer Harbour to West End, They can go to different families and so forth. So there's a little difference which we recognize. We had to treat it differently because these different people move about differently. So that is the difference there.
Thank you, PS. PS, I have a question from a driving instructor who is asking if once he is wearing a mask and the trainee is also wearing a mask, if it's okay to do driving instruction.
What date are we talking about?
I missed that, Dr. Andrew. Can you repeat?
I was asking if you what specific dates, because remember we're planning to move towards restriction of movements, gradually restricting movements within a week or so. So my
Okay.
first question would be what dates are we talking about?
You're talking about today.
Because I'll be pretty much back to normal, right?
I'll have to double check. Are we with regard to driving school? Is that an allowed business right now? I don't know if that was approved. Is it?
Right at this moment.
Not at this moment. I don't think we allow driving schools to start at this week.
Not as yet. So
Not
I
as
can.
yet.
The answer is not as yet. Within next week or thereabout.
Yeah, we certainly will be looking at which businesses we will sort of de-escalate in Exco this Thursday, and by Friday this week, persons will know which new businesses can come on.
Thank you, PS. Dan William. James, you have your hand up. Class FM, right after.
No, sorry, my hand is down. Sorry, it's down.
Class FM, you can go ahead.
Yes, good afternoon again. Minister of Tourism, maybe you can answer the question for me as relates to the recent discussion here in Anguilla about legislation relative to the labor law. Persons would have reported to us that coming out of a meeting, a recent tourism stakeholders meeting, that there would have been some amendments. Can you speak to me about that a bit? Are you aware of that?
I thought that what came out of what was discussed on Class FM relating to the recent stakeholders meeting was a misrepresentation of the facts. I thought it was a total misrepresentation of the facts because that discussion in that form did not occur. What happened is the question was raised as it relates to mandatory vaccination in legislation. And the parliamentary secretary said, as it relates to that, people will be given, in a nutshell, people will be given the freedom to choose the direction in which they want to go, whether that be the employee or the employer. Coming out of that, one of those persons who were in that stakeholders discussion via Zoom misrepresented the facts on your radio station. So I'm not going to blame you, but that was a total misrepresentation of the facts.
Okay, and while we wait, Ken Hodges answer for the question I asked earlier. So I'm not sure who this question is for, but in terms of mass gathering, will the restrictions be lifted after June 1st? Some persons are not clear on that still. After June 1st, will those restrictions be lifted on mass gathering?
Yes, you can take that question.
Yeah, that is currently the plan. Certainly June 1st is when we should get back to as normal as possible. We still will have social distancing and mask wearing in place for a while, but certainly we will try to lift most, if not all, restrictions by then. Of course, as we normally add a proviso, it depends on the situation in the country.
All right, thank you.
Thank you very much, Class FM. I see Brenda. Brenda, is that you?
Yes, it's me. I have a question about Anguilla Day. Anguilla Day is right at the end of the month, and you say you're going to relax things on June the 1st, regulations on June the 1st. So my question is, we do know it's going to be virtual, it's not going to be at the park, but the media hasn't received any actual description of what is going to take place in the virtual. And is there any, people are asking if there's going to be a boat race?
Certainly, I'll allow the Premier. Can you answer that question? I was about to answer it, but I think that question was for the panel. Go ahead, Premier.
Well, I'll say yes. Anguilla Day will be virtual. There will be no boat race for Anguilla Day, given the conditions as they are. And as the Permanent Secretary said, we are working to get to the 1st of June where we can lift most of the restrictions, and that is the plan right now.
Thank you.
PS, you have anything to add?
No, I would just like to confirm, Premier, that I think we have been very, very fortunate that we've been able to get this far. I don't think, and I do think that people realize how close we were to a national catastrophe. But certainly because of the quickness of the community to respond, we have gotten to a point in about a month, it's just about a month now, where we're able to contain the spread of the cluster through the hard work of members of the health team, but also through the response of the community, the response of the public. And I want to thank them so much. We still are keeping our eye on stuff, and we still don't want to take our eye off the ball. That is why we are not having too many big things for Anguilla Day. We still have our eye on a long game, and we want to make sure that we finish out the month very safely and on a very low-key note, so that when June comes, we can be well on our way to welcoming people back in July for a better summer and then a better new season in the fall.
Yeah, PS, I just want to say it shows how vulnerable we are and how quickly this can happen. As you know, a month ago, there were 3 cases and quickly they escalated. And I too want to thank the public and want to thank everyone who was involved, the government of Anguilla, the Premier and his stellar leadership to ensure that this was contained and put to rest. We can say that we have no known cases, but that does not mean that we don't have any cases, so we still have to be vigilant in the interim. So I just want to thank everybody, including the general public, for their participation, because without them, this could not be possible. And I feel proud to be an Anguillan today. We see everywhere around us. We see what is happening in St. Kitts Nevis. We see what is happening in St. Martin. We see what is happening in Jamaica. We see what is happening in Trinidad. We see what is happening everywhere around us. And I feel so proud to be an Anguillan and to be where we are today. And I can thank God, but I also have to thank those people who have worked so hard, because as the good book said, faith without works is dead. And we can pray and we can pray, but unless we are willing to do the work that is necessary to ensure that those prayers come to reality, it's dead. So I just want to, from the bottom of my heart, I just want to thank everybody, not only those here on the panel, but also to the general public who made this happen, who made this a reality. Premier, we don't have any other questions. So with that said, if you would like to grace us with some closing remarks, we'd really appreciate it.
Minister, crave your indulgence. You know, I love that, you know, ending you just had there. It just shows that, you know, we have a lot to be thankful for, and especially to God. But if you can see if the CMO, PS, the commissioner have any closing words before I say my last piece, that would be great.
Beauty before age, so I'll allow the CMO to go first.
Well, flattery is always great, right? No, but in all seriousness, I thought the minister wrapped it up nicely, that we have a lot to be thankful for, and let's just keep it going. Let's keep our eye on the prize. And as the PS said, we know the goal in front of us. We're working hard towards that goal, and we just have to keep on as we have been. We're very, very close to the finish line, and I think if we continue on the same path, we'll come out of this better than we went in, quite possibly. So I'm very encouraged, and just to echo the sentiments, thanks to all that have supported us, our team, the public, and so on. And we just have to keep going as a team and as a community.
CMO, PS Rogers.
Yes, I second that motion.
Before you go, PS Rogers, I know PS Rogers is anxiously waiting for the barbershops to open. His beard has gotten as long as Methuselah's. So, PS, your closing remarks.
Yes, so thank you so much. Yes, I do miss my weekly therapy session. You know, a barber is more than someone who cuts your hair. A barber is someone who listens to your troubles and you talk with them. And certainly, as human beings, we want to get back to where that was. I just want to echo what Dr. Isha said. Thank the people of Angola so much for the response. Thank you.
Thank you, PS. Is Commissioner of Police, Mr. Lynch, still on with us?
Yeah, I'm still here. I can't say anything more than really everybody else has said. It's just been, from my eyes, as somebody who's just come to Anguilla, it's been a fantastic effort by everybody, and you really have missed, as Foster says, you missed the bullet. Really, it's been an amazing piece of work by ourselves, by the health team, by the public, by the Prime Minister, by the Premier. It's been excellent. Really impressive piece of work to watch.
Thank you very much, Mr. Lynch. Hopefully it'll be Prime Minister in Juala. Premier?
I knew you would jump on that one, Minister, because you know you are the proponent of independence for Anguilla, and certainly it's a aspirational on our part. You know, I definitely want to say that the effort is commendable by everyone involved, and we've been getting calls. In fact, the minister knows that we've been in touch with the government in St. Martin. Just yesterday, we were on with the ministers and the leaders of the monetary union, and from the OECS, and it just shows that they are looking to us for and asking, you know, how we handled the situations we were in as the numbers are rising in their countries, and it just you know, it brings pride. As the minister said, he's proud to be an Anguillian at this time, and so am I. And you know, I too, just from the bottom of my heart, want to thank the health team for the yeoman effort that they've put in, for the Royal Anguilla Police Force, for you know the border patrols and border security that they're providing. Certainly, we know that this is not easy to do. It's not easy even for people to stay in one place, but so far I can say that the majority have followed the protocols, have followed the regulations, have maintained you know, the social distancing, the mask wearing, have stayed at home, you know, and that's the tough things that have helped us to get to this point. And I hope that we will continue to know that it is not because the regulations or the Constitution or the laws of Anguilla allow us to do things why we do it. We do it because the science and the epidemiology demand it, so that we can be in this place where we are now. You know, if we had not followed the guidelines, then we could have had a much worse outcome. And we only had 3 people hospitalized from the cluster of 78. Just imagine if this had got blown up, and how many beds we would have needed. Hospital would have to be closed to anybody other than COVID patients. And we can't afford to be in that state. And so, again, I want to thank everyone for doing their part. We continue to do this together as patriotic, caring Anguillians, and as Anguilla Day comes up, you know, the unity that kept the people of Anguilla at that time to have a successful revolution. I want that same spirit of collaboration, of cooperation, and of brother and sisterhood to guide us as we move forward. I want to thank you, thank all who came out and to participate, the media, the Permanent Secretary in Health, the Chief Medical Officer, the ministers that are on, and certainly the listening public. May God bless you, and may God continue to bless Anguilla. Thank you.
Thank you very much, Premier. I believe our next scheduled press conference is next Tuesday at 3 p.m.
That is correct, and because Monday is a holiday, which is Anguilla Day, and then we'll go back to Monday afternoons at 3 p.m. Starting the following week.
Thank you very much, Premier, and thank you all, and thank you to all the listeners. I'm sure there are questions that are on social media and suggestions, and we look to them as well and try to answer them as much as possible. Thank you again. May God bless you, and may God bless Anguilla. Bye-bye.